My name is Amelda Smith. I am from Long Island. I currently live in Brooklyn. I was a little hesitant to go through pregnancy when it seemed like the world was ending, kind of. I felt anxious. I had a lot of regrets. You know, it was a lot. It was a lot of emotions finding out that I was pregnant with COVID.
Her initial presentation, it's a common presentation in pregnancy because she presented with shortness of breath and chest pain, which can happen. However, she presented in 2020 during the height of COVID. And so we were concerned that maybe this was affecting her heart.
I remember walking into the room and seeing how Amelda was sitting completely upright. She looked at me with eyes of pure desperation and fear.
Amelda was referred to the cardiologist in the cardio obstetrics program at the Katz Institute for Women's Health. The institute is comprised of a multidisciplinary network of over 600 experts across 25 specialties, providing comprehensive care for women, helping them achieve the best possible outcomes.
I just knew something was wrong with me. Because every day I was at the hospital, I started to decline further. Normal things were getting harder and harder for me to do.
My biggest fear, which unfortunately came to fruition, was the fact that Amelda is going to be one of those patients that comes in with a multi-inflammatory syndrome that affected her heart and all of her other organs.
We all come to the table, we all present the patient, we all raise our concerns, and we all come to a concerted plan with the patient. And so with this particular patient, we actually had several meetings over days talking about what's best for mom, what's best for baby, what can we do to optimize both.
Her course within the first 48 to 72 hours, probably one of the most scariest and the rockiest one I've ever seen in the patient.
They were really invested in making sure that I came out of this, you know. They were willing to just listen. They were willing to stay up all night. They were willing to stay by me and hold my hand the whole time just to make sure I felt safe and comforted. Like, it really means a lot to see everybody respond the way that they did.
I know that our maternal fetal medicine team, I think I could use the word obsessed, about this patient. And we talked about Ms. Smith and her management minute by minute. And I think anyone who comes to a Northwell hospital can be assured that under the Katz Institute of Women's Health, that this multidisciplinary institute is going to provide excellent care.
Later on in the pregnancy, Amelda actually developed an adverse pregnancy outcome with elevated blood pressures and heading into preeclampsia, which is unfortunately a very common adverse pregnancy outcome, especially in African American women.
I didn't really feel like I was going to die, even though that's what I was hearing. When I prayed and seeing Dr. Grayver show up, that was confirmation for me that God heard my prayer. And sent someone immediately who I already felt comfortable that that person was going to make sure that I was okay.
The question was how well and how safe we can deliver her. So intubation in the operating room, delivering the main OR, NICU in the operating room to be able to take care of the baby right away. So it was a lot of people and persons coming together and making the decision that it was actually the right time for the delivery. I think that was actually the hard call to make.
When I finally got to see him, it was absolutely amazing. It felt like the biggest victory ever. Like, he and I did it. God really put the right people around me at the right time that really was invested in my healthcare, and it really means a lot to me.